Hi, everyone. Hope everyone's having a great day. It's Dr. Avina. So excited to be here. So, we're going to have a special guest that's going to be joining us in a couple of minutes, Dr. Suzanne Solomon. And I am so excited to have her here. Hop in, so we'll just give her a second. And so, it's National Nutrition Month still. And we are so happy to be joined by Dr. Suzanne Solomon. Hi.
Hi, how are you? Great to see you. How are
Oh,
you, Dr. Avina?
good to see you too. So I was just telling people we're waiting for people to join in, that we're still in National Nutrition Month. It's March, but it's almost coming to an end. And I am just so excited to have you here today talking about nutrition because you are like my go-to person when I think about, what can we do to improve our nutrition and how can supplements help? You always provide such great content and such great information about this. So I was hoping you could maybe just tell us a little bit about yourself, tell our viewers all about you and what you're up to and how you got so interested in nutrition.
Thank you. Thanks so much. So I am a pharmacist by training and I did residency and fellowship. And during some of my clinical work, I noticed that patients would come into the clinic and often complaining of the same symptoms over and over again. They're tired, and despite trying regular prescription medications, they just weren't getting better. And through my work, then I discovered certain labs that would look at micronutrients and look at the patient's lab values and started looking more into supplements and really started to change people's lives by them actually taking supplements and eating a little bit better. And then all of a sudden you would see them say, you know what, I don't need this medication anymore for my depression, and I don't need this medication anymore for my diabetes. And so it was kind of life altering as well. And so I've really just become an advocate for supplements because I think that we all need them if we're not eating properly. First, I think you need to eat properly, but then if you're not, then I think the next step is really to make sure that you're on the appropriate supplements as well.
Yeah, no, I love that. And I think that you're such a pioneer in this area. And I think that our viewers are going to absolutely love this because I think that one of the big things that, I think many people are becoming aware of is the power that nutrition and supplements can have in terms of, not only making us feel better, but also in preventing us from developing complications down the road. And I think that's really, something that a lot of people are keen on learning more about. What do you think in terms of, in your practice? I just think it's so interesting because you're coming at this as a pharmacist, right? We typically think about pharmacists as only dispensing drugs and telling us, what medications are going to not jive well together. And so I think it's so interesting that you're, incorporating the supplement and the nutrition component into this. What do you think in terms of your practice is like the biggest thing that people are deficient in when it comes to nutrients, and what's the supplement that tends to help people the most?
So I think I would actually say there's a few, but
Okay.
vitamin D is definitely number one. I think vitamin D is a supplement that so many of us are just deficient in, and we don't have enough. And whether it's from the sunlight, I actually think there's a statistic that showed that 95% of American adults are not meeting their estimated requirement of vitamin D
Wow.
through their diet or through sunshine. And a lot of us don't live in sunny places,
Mhm.
such as myself. So it's
Me
quite
too.
difficult, yeah, to get that sun. So I think vitamin D is probably the biggest one. Another really big one is vitamin B12 as
Mhm.
well. I think that the other thing is what supplements to take. So
Mm.
in my practice, I've also seen so many patients deficient in vitamin B12, but then maybe they're taking a supplement and it's not really making a difference. It's either not enough or the type of supplement is not good. And so I think that that's the other option. So to know that there are options for with that, you can take an injectable vitamin D, that might be better versus the oral one. The other ones, I think, pretty much all the vitamin Bs. And I think what's interesting is that a lot of the vitamin Bs are what people are deficient in. And then they think that they're getting it enough from diet, but not
Mm.
necessarily always getting it. And going back to the medicine, and as a pharmacist too, many times I've seen patients come in and complaining of side effects. Well, I'm taking this medication, but all of a sudden they're developing some other side effects. So I think it's important before starting any prescription medications to really consider and look at vitamin and micronutrient deficiencies before actually starting any medication at all.
Yeah, and so what would be like the first step for people to do that? Because I know obviously like your primary care physician, hopefully would be open to doing something like that, but maybe not every doctor is. And so what do you recommend for people who, maybe want to take that first step and really just get an assessment of their micronutrients? Like what would you suggest that they do?
So I definitely recommend finding a clinician who can test your micronutrients. So there
Mhm.
are labs that will do a panel. And definitely your primary care might test your vitamin D, your vitamin B12. So I think some of those low levels, just ask at your next physical. But you need to be your own advocate. I really
Mhm.
advocate for the patient to be your advocate. A lot of times it's just kind of check the box. Okay, I saw this, check their temperature, how you doing, your weight. Okay, it's up a couple pounds, but and then there's really no follow through. So I think being kind of like two parts. So as a patient, make sure you're your own advocate, ask for it, ask up, look for it. And then the second part is following up. It is critical to follow up with the provider or whoever you need to. So many times there are patients we might make recommendations for, and then they just fall off the bandwagon. So I think you really want to make sure you continue to follow up after that.
Yeah, I'm so glad you said that because I think that a lot of people get that, that white coat syndrome when they go to the
Yeah.
doctor, right? And you're thinking, oh my goodness, they're busy. I don't want to bother them. And I should only bother them with my important questions and things like that. And I feel like we do need to be our own advocates. And, it is important to speak up because, especially this day and age, I mean, I find it very uncomfortable whenever I go to get a checkup. The doctor doesn't even make eye contact with you often because they're clicking away on their keyboard and taking notes. And
Yeah.
I think it's important to establish like a rapport with your provider so that you feel comfortable asking those questions and not to, just think that it should be something that's dismissed because there are quite a few different, common symptoms that emerge that can be linked back to some of these micronutrient deficiencies that we're talking about. So it is important to have a handle on where your levels are.
Definitely. So I think that's important. And I think the other thing is if you feel like you can't ask the question, because you can, I mean, physicians, everyone was trained to help the patient, and that's what we're here for. So pharmacists, everyone. So you don't feel that you can't ask. But I think the other part is that if you're not comfortable with asking, then maybe that provider isn't the right provider for you. So you might need to look for a different provider potentially as well.
Yeah, I think that's a really good point because I think a lot of people, assume that they have to stick with whoever they're seeing, and that's actually not the case. It's really important to make sure that you do have a good rapport with your provider, and that might mean shopping around a little bit or, trying somebody else just to see if it's a much better fit. Because I feel like, we don't always look at it as a relationship, but it is a relationship, and it's probably
Yeah.
one of the more important relationships you can have outside of your personal relationships because this is the person who essentially, is taking care of your livelihood and your life. And so I think it's important that you feel like that person's approachable and you can talk to them about a lot of these things.
Yes, definitely. And I think that I just even think back to some stories, even a specific patient who was referred to my clinic and she was on certain antidepressant, prescription antidepressant medications. And they said, it's just she's resistant and something's going on. We're seeing a lot of resistance. She's still having symptoms of depression. And then I said, well, can we check her zinc? And there's so many studies that show that if you have a deficiency in zinc, antidepressants don't work.
Oh, wow.
And so we checked it, we fixed that, and believe it or not, she needed half the dose of the original prescription she was even on.
Yeah,
So, just checking in, asking others, making sure that everything else looks good really does make a difference.
that's so true. Yeah. And when you hear, stories like that, like these reports of individuals, then having a very different treatment plan happen because, they discovered that just adding this supplement to their diet can make a world of a difference. It really makes you think about, the importance of knowing how you stand in terms of the different, micronutrients that we have. And we have so many of them. And I think for, many people, one of the things that I think, unless you're in the nutrition world, it can be a challenge is just it's almost like alphabet soup, right? There's so many different
Yeah.
micronutrients and people tend to kind of focus on the macros like, okay, I know I'm supposed to like limit my fat intake and limit my carbs and try to get enough protein, but if you say to somebody, well, how much, selenium do I need? They're not
Yeah.
necessarily going to be able to pull that number out of the top of their head. And also where to get it. And I think that's another challenge is that we don't really learn in school, which foods contain the right amounts of these nutrients. So I'm just hoping maybe you could take a little bit of time to, from the nutrition food standpoint, what are your like top few foods that you recommend people really try to incorporate more into their diet, especially if they're looking to boost their, micronutrients?
So for me, I think some of the staples that I recommend, definitely one is honey. Believe it or not,
Mm,
I do love honey, and I'm a big advocate for honey. I've seen it in my own personal clinic, and just raw, very raw. The darker the honey, the better. But very, less than a spoon a day really can make a difference. I think in terms of probiotics, I love recommending kefir to everyone to
mm.
have in their fridge. If you're not a vegan and you're okay with that, there are other options if you are a vegan, but kefir is another one of my staples. And in terms of foods, I think that either having some hummus or guacamole, something in your fridge where when you're craving vegetables and you're like, well, I don't really want to eat them plain, that those are really go-tos. And some of those, such as hummus, has precursor for tryptophan, which can help even with depression and different
Hmm.
things, improving mental health. So I think that some of these foods are amazing. And you're right, we weren't taught that in school, that this food has this. And even going back to vitamin D, I think mushrooms are a big one. I love recommending mushrooms. And I know a lot of people don't like the taste of mushrooms. So I'm always like, try the different types. There's different kinds of mushrooms.
Yeah.
But mushrooms is a good one, as well, especially for vitamin D. And if you can't eat enough of it, then I always say that look into the supplements.
Yeah, vitamin D is a tough one because, we have foods that are fortified with vitamin D, like, some like cow's milk, different beverages will have vitamin D added to it, but there aren't a ton of foods that actually contain, vitamin D naturally. So,
Right,
I
right,
think that's a challenge for people. And, if you're of the mindset where you're maybe trying not to eat processed foods, that's a good thing, right? But
right.
you might also actually be missing out on some of the nutrients that are fortified because, for instance, like breakfast cereals, I'm not a big breakfast cereal fan myself, but they do have the advantage that they are often fortified with a lot of the nutrients that we need
Exactly.
that we don't get from typically eating foods alone. So I think that's something that, we have to be mindful about is, the sources that we can turn to when we are, choosing what foods to prepare. I personally love mushrooms. We've been eating them a lot in my house. And I think you're right. You have to get a little adventurous because I was always like a little bit hesitant to try some of the more exotic looking ones. And I was
Yeah.
like sticking with like the white button mushrooms, but we've since moved on and have been trying them all. And it could be a lot of fun. And I think that, it's just important to diversify, right? And I
Yeah.
think that's one of the things that I often recommend to people when, you're trying to boost your micronutrients. You want to make sure you're eating a variety of foods because if you're eating the same foods over and over again, you're most likely going to become deficient in one or more of them.
Exactly. I think that you just hit the nail on the head because diversify just all the colors in the rainbow. You can't go wrong. And I often recommend soups. I personally love
Mm,
soup. So just mixing in pretty much any vegetables you have in your house and just kind of throwing them into a pot, and all of a sudden you have this food. I know it's great for me. I have 5 kids, so always on the go. And it's like, well, this is a great, mom, I'm hungry. And instead of reaching for a cereal box, I'm like, well, there's soup on the stove, just grab it. And I put in pretty much everything you could think of, whether it's yams. I mean, everything that I find in my house, sometimes I'll just dump in there and come up with some sort of soup. And it works, especially for kids. It's really great.
yeah, that is a really good idea. I love that. And speaking of kids, because that was something I meant to mention, you're also, in addition to all the wonderful things that you are, you're a pharmacist, you're a professor, you're an author, you're a mom. And so can you talk a little bit about, the kids and nutrition? Because I think this is something that a lot of people, parents, especially struggle with these days is, getting our kids to eat healthy foods. Because I know I have kids too. And my, teenage daughter, she's okay. My little one's still under my control a lot because she's only 6, but my teenager's starting to, not be as easy to coax into eating all the healthy things that she used to be. So, what is your advice as a mom and also, as a pharmacist and nutrition expert in terms of getting kids to eat healthy foods? Do you have any tricks?
So you're right. As they age, it definitely gets a lot harder. And then they're going out with friends and they might, want to just stop somewhere quick. So it definitely gets more difficult. But I think instilling a lot of the habits from a young age is important.
Mm-hmm.
And I think cooking at home with a lot of ingredients, I often found, at least in my own kitchen, that the more I put in, they might say, oh, I don't want the zucchini today. But then all of a sudden they might try it because they're hungry, and that's what's around. And so just putting it out there for them. And sometimes, I know in my experience as well, some of my kids are less picky and others are very, very picky, you know, like this, the green beans can't touch this and this can't touch that. And so that's been an adventure as well. But I've always recommend just kind of putting it all out there, letting them try everything and taste everything. And then you kind of come up with different things. The other thing I always do, or I've done recently at least, is ask for suggestions for my kids. So I always try to incorporate them into the dinner. So I'm like, okay, today is such and such's turn to pick what we're eating. Today is someone else's turn to pick what we're eating. So they kind of get excited when it's their turn, and then they'll eat what their brother or their sister might have recommended. And that does help too.
Yeah. Oh, I like that idea. I've tried something similar where I'll let my kids take turns picking one of the side dishes that we're going to have with dinner. And I
Yeah,
think, you're right. Having them be a part of the meal and making, some of the major decisions that go into it is a great way to allow them to pick things that they're going to want to eat. But then also, I think it helps to make them feel like they're a part of the decision. They're not just being told what to do.
exactly. Yeah. And then it just gives them a little bit more interest in it as well. So,
Yeah.
that they find more interest in it.
Yeah. And in terms of the kids too, what do you see in your practice as like the most common types of nutrient deficiencies that kids experience? Is there something that stands out, especially with little kids?
I think kids can be anywhere on the spectrum. That's been my experience, that it could be all over. But what I try to incorporate a lot of times is a probiotic into the kids,
Mm.
because a lot of them experience gut health issues because many times they're just eating three meals, chicken nuggets, mac and cheese, and French fries. And even when you go to a restaurant, if you ask for the kids menu, I just loathe the kids menu. I'm like,
Yeah.
what are you doing to these kids? So I think for me, I always try to go that route of like kefir or probiotics and trying to get that gut health in there as well for a lot of the kids.
Yeah, that's so true. And I'm glad you said that about the kids menu. I mean, it's literally the same kids menu in every restaurant. You could go to like
Yeah,
Mexican, sushi, like wherever you go, it's always the same like three things that are just
yeah,
universally not good for kids. Um,
exactly.
yeah, so I think it's so much better to just let them order off of the adult menu and like pick
I
what
do
they
that.
want.
Yeah, or they split it because my younger
Hmm.
ones are younger. I'm like, okay, well, you guys pick one thing, and they love salmon. So I'm like, okay,
Hmm.
you guys can split that together. And I just try to figure that out because yeah, I can't with the kids menus. I'm just like, no, we're not gonna look at the kids menu today.
Yeah, I'm with you. I'm with you. There's usually not much good that you see off of that. Um,
No, not at all.
So tell us a little bit more about, I'm just really curious from your background. It's just so unique because it's not every day that we see, pharmacists in the nutrition world. Was there something like special that led you down this path? Or was it just something that I know you said you had an interest in it, but I guess I'm just curious if there was something, were you always interested in nutrition, or is this sort of something that just kind of happened in your career?
So I was always interested in healthy eating. Different foods, and I think certain foods I would try them, and I said, you know what, this always made my stomach not feel great. I felt
Mm,
bloated after eating this, and this I would eat and I would feel okay. And I started to just develop more of an interest, and then all of a sudden gut health started to become a really
mm,
popular topic, and even mental health. There's so much out there now on mental health, and I love the analogy of nutrition and, your brain is always working, your brain's always on and your brain's always working. And fuel comes we need fuel for our brain, and that comes from what we eat. And I think for me, that was where I was very interested initially early on. I said, you know what, I noticed that ice cream makes me feel sick. And I love ice cream, but every time I have it, I'm just, I look like I'm 10 pounds heavier, or I'm pregnant and I'm not pregnant. And I don't know what's going on. So for me, it was really just, how I felt when I was eating, and then started talking to more people, and even just with my patients and seeing them starting new medications and a lot of the fears, because I think we don't talk enough about the fears when a patient starts a new medication. They're scared.
mhm.
What is the side effect? What is this going to do to me? Will this make me sleep at night? Will it not? And I have so many, even just friends who will reach out and say, my physician just started me on this medication. Can I take it? You know, what do you really think? Is this okay? And so we don't address the fears enough, and we're not looking into nutrition before we're trying that. And so I am a big believer in non-pharmacological before we start the pharmacological. Yes, I still believe that, you know, medications can help, but I think there's so many steps that we can do beforehand before you even try that pill at first.
Yeah, and I completely agree. And I think that we're starting to see a shift, I think, because, 20 years ago, if you had said this, nobody would have been listening, right? It would have been
Yes.
one of those things where it's like, what are you talking about? The doctor says you need medication, you need it. But I think now, because of the research, and we're learning so much more about how different foods in our modern food supply, I mean, our food supply has changed dramatically. How that can impact our brain health, our gut health, and, how some of these things that, look like they might be requiring a pharmaceutical actually might be able to be rectified or alleviated to some degree if we make it a change in nutrition and our environment. And so I think it's so great that, there's doctors like you out there that are, having this conversation and allowing people to ask the questions. Because I think you're right. There is a level of fear about, the questions that people have. And it's so wonderful that you have this open forum for people to get the information that they need.
Yeah, no, thank you. I love it. I mean, I am a pharmacist, but I just feel that there's so many things we could do before
Mm-hmm.
popping those pills. I think that there's so many other things that we can put in our mouth and, to make us a lot better and a lot healthier than we need to with just popping a pill right, at first step. And I don't think I can go back. And another thing, and I didn't mention this before, but this is really another thing. My daughter was getting headaches, and she was 3, and she kept complaining of headaches and all this. And then I took her to get the MRIs, and thankfully everything was fine. But at that point, they said, okay, well, she can start migraine medication. And I'm like, oh my gosh, like, and I'm a pharmacist, and I get the side effects, and I get there's an indication, but it was like, there's no way I'm going to start my daughter, who is 3, and her, I know my husband's sister there's just a family history of migraine. So I knew there was something going on with that, but I said, there's no way I'm going to start her on this. So I started to look more into the nutrition and fixed it by just really fixing her diet. And now she knows, oh, mommy, I can't eat that. Mommy, I can't eat that. That will give me a headache. This will give me a headache. So that's
Wow.
really the other area that made me very passionate about this.
Yeah, I think when, certainly when something happens to one of your children, it can really be the motivator to, figure
Yeah.
it out. And so I'm just curious, what were the foods that were triggering her headaches? What were you able to identify?
The biggest one was chocolate milk. So I was
Really?
giving her chocolate, and any chocolate. So for her, chocolate is just a trigger. So she could have, the other day, she was at a party, and then they were passing out these little small chocolate eggs. And she was like, I can't have that because that's going to give me a headache. And at this point, she knows, a couple of years later. But so chocolate was a really big one. And she used to have chocolate milk when she was younger.
Mhm.
And that was just, so I just nixed it. Right now, we have no milk in my house at all. I don't even have milk in my fridge. I mean, I have non-dairy milk, but
Right.
not, the typical. And so that was the biggest one. And then anything related to MSG or foods like that. And then the red dye. Also, I noticed all of the red dye. I was like, no more, none of these cereals, none of that. So those were all
Wow.
the three major triggers. And it still happens till now. If she does have chocolate, all of a sudden it's, oh my gosh, I have a headache, and I don't even say anything. It just happens. So
That's amazing. Yeah, well, it's so great that you were able to identify those triggers. And I have a feeling that this probably happens quite a bit where,
yeah,
especially because like the things that you just talked about, chocolate, dyes, these things are in so many of the products that our kids eat that are marketed
right.
towards kids. And so, it's probably not uncommon that, kids are walking around with some of these symptoms like headaches, belly aches, things like that, that we could probably link right back to the ingredients in the food.
Right, exactly. Yeah. And it's sad because a lot of people might have just went straight to the pill, and every time she got it, oh, we'll just take your medication, and she'd be
Right.
knocked out sleeping for 12 hours, and I'm like, I
Yeah.
cannot do this to this little girl. I'm not going to just give her a medication. She's going to go sleep. And then I'm like, what kind of habit is she going to develop as she ages as well? And so yeah, I think just understanding, that there are other options out there, and that that's not the go-to all the time, is what, the prescription medication is not the go-to.
Yeah, I think you're right. Like getting to the bottom of it and just getting all the information that you can about what the condition is and what the symptoms are, so that then you can take all the steps. And I almost
Right.
think it's almost like a holistic approach to your health. We, obviously have like the three-legged stool of our health, right? We have maybe pharmaceuticals when we need them, but we also have nutrition. We also have our immediate environment in terms of exercise, reducing stress. So there's all these different components that feed in to how we feel. And I think it's great that, there's people like you who are helping to educate others about the balance that's important to have there.
Thank you. Yeah, no, thank you. It's critical. I think, we need the balance. That's exactly what we need. So,
Absolutely.
we got to push for that.
Absolutely. Well, Dr. Solomon, I'm so grateful that you joined us today and we were able to have this chat. Can you tell the viewers where they can learn more about you and get information about you?
Sure. So you can find me right here on Instagram, Dr. Suzanne Solomon. And you can also find me on LinkedIn if you're in there. I see a question that just popped up too.
Oh,
Thoughts
yes.
on nutrition for ADD.
Yeah, let's
So
take that.
yeah. So that there's a lot on there. I actually recently posted, so you can even find that answer on my Instagram. But there's a lot on that. I think that going back to some of the dyes, that's a big trigger for
Mhm.
that as well. And then there are quite a few micronutrient deficiencies that can actually cause the symptoms. And so working on those with yourself or with your child is important as well. So again, it goes back to just any other disease state out there, that's a big one as well. But yeah, you can find me there. You can find me at drsuzannesolomon.com as well. If you need to find me there.
Okay, great. All right. Well, thank you again so much. It was a pleasure to talk with you, and thanks everyone for listening. Have a great day.
Thanks. Bye.
Bye.